My name is Samantha Lobbo, and I'm a community health fellow at SOCHARA. I'll be completing my 1 year of fellowship on July 2nd. I am from Bangalore. My background is dentistry, and also I am from a public health background. I've completed my master's as well. So I'm just going to speak a little about my journey in community health and how has it been so far. It all started off when during my undergraduate studies, wherein I got to see a lot of patients and interact with them, and I noticed that it was always that we treated only those who could afford the health services provided at our hospital, and those who couldn't afford the services, they had to always go back home disappointed. And this really affected me, and I used to question myself a lot as to why these people have to, go back and not be treated just because they don't have the finances. And these questions were always burning within me, but um, they always got suppressed due to our medicalized education system. And as the years went by, during my internship, I also got to see 18-year-olds and 16-year-old boys coming with precancerous lesions in their mouth. So I questioned these youth as to why they were into this habit, and they're in such a bad situation at the moment. And the only response I got was, they said, we didn't know that it contains such harmful ingredients in it. We only like it because it tastes good. And that kind of invoked something within me as to health education amongst the people or the communities that belong to the marginalized areas. They all needed some kind of help and assistance. So that made me think as to what I can do and how I can go about next. And that's how I joined the Masters of Public Health course, hoping that I would get some insight into how I can help these marginalized communities. But unfortunately, I only got the theoretical experience, and I only got to learn everything like how it is in college. Like, this is this, and this is research, this is health promotion. But I never got what is a practical experience. And after completing the 1.5 year course, I was still searching, and I was still wandering around as to what and how can I help the marginalized communities. Um, the first thing I did when I returned back was to Google for a community health internship. And the first organization that came up was SOCHARA. And I said, okay, fine, let's have a look, let's see what they say. And they were the first organizations amongst the many who had applied to, who replied immediately, like in a day or a two. And I said, okay, fine, let's move on, let's go see them, visit them, and come back. And my first interview or informal interview was with Dr. Thelma and Mohammed sir. And it was really fun and interesting, because Dr. Thelma was just sitting there and listening to me go on about how I want to do something about oral health and tobacco. Ma'am, I want to do something in this field. It's only this. And I could see her sitting back and just smiling away. And I think in the back of her head, she was thinking, you wait, you just finish this 1 year of fellowship, and then you'll know what the reality is about public health and how you will have the shift over. So I joined the fellowship immediately as soon as I completed my interviews, and the journey has been excellent. My first field placement was in Baptist Hospital, Bangalore. And out there it was interesting because I got to see how urban health plays a very key role in public health, how the urban slums of Bangalore are struggling, and how the people or the communities in this very slums are struggling to make ends meet. I got to see in the collective sessions the social determinants of health, and this was, few of them were seen in these urban slums. But the thing that I think was the life changing or the moment changing experience for me would have been when I saw that, oh, I'm the expert, I need to tell them that malnutrition is a problem in these slums and I need to do something about it. But I was constantly reminded by Dr. Thelma and the team that it's not about you being the expert in the community, but it's about what they want and what they need, and to focus more on that rather than what I feel is the need of the community. I think this was brought to light to me when I visited Kalahandi, Orissa. And out there, I was working with the tribal community under Dr. Sister Aquinas. And I really got to see the realities of life. It was like traveling back in time in this day and age, 2014, to actually see that there are people living and struggling with no access to health, education, and transportation, who are living with the diseases that they have, just assuming that they don't have any other option because they don't have any financial support. To be socially excluded from the community is something which I got to see out there. And I really thank my mentor Kumar sir for pushing me forward and saying, just take the leap. And after going there, I got to see all this and the social determinants of health. Anything you mentioned, nutrition, um, transportation, education, access to healthcare, anything, you could all see it over here. And the people just continued to live, moving on with their lives. And it was really a reality check for me myself. And after that, the collective sessions that have happened out in SOCHARA have really changed my perspective or thinking about health. Being from a medical background, the biomedical approach has changed completely now. The paradigm shift has happened. But I hope that this paradigm shift continues within me and my community health journey doesn't stop just here. I hope to continue and spread the light of health education and health promotion amongst communities as much as I can. Thank you.